Tattoos.
What is it? Why permanent? Effect on body and health? Ethical? Let's explore this topic in minutes. There are many forms of body modification and mutilation. In general, voluntary changes are considered modifications and involuntary ones are considered mutilations. Common methods that have been used are incision, perforation, complete or partial removal, cautery, abrasion, adhesion, insertion of foreign bodies, compression, distension, diversion, and staining. Tattooing is considered a form of skin modification as it's voluntary. The increase in piercing in the late 20th century was accompanied by a parallel increase in tattooing. However, medical complications and health risks can occur when getting a tattoo.
Tattoos are a form of permanent body modification or adornment that is created when an electrically driven needle inserts ink into the dermis. The process, which is done without anesthetics, causes a small amount of bleeding and slight to potentially significant pain.
Why permanent? Tattoos appear under a microscope as tiny granules of color. These granules are located in a skin cell known as a macrophage. Macrophages normally remove foreign objects that enter the body, for example, bacteria. The pigment in the tattoo freezes the macrophage cell so that it can't do its job. As a result, the pigment remains in the skin and the tattoo becomes permanent. Removal? Tattoo ink is placed beneath the top layer of the skin. That makes tattoo removal more complicated and expensive than the original tattoo application. Common techniques used for tattoo removal include laser surgery, surgical removal, and dermabrasion.
Effect on body and health. Tattoos breach the skin, which means that skin infections and other complications are possible, including allergic reactions. Tattoo dyes can cause allergic skin reactions, such as an itchy rash at the tattoo site. This can occur even years after you get the tattoo. Skin infections. A skin infection is possible after tattooing. Other skin problems. Sometimes an area of inflammation called a granuloma can form around tattoo ink. Tattooing also can lead to keloids. Bloodborne diseases. If the equipment used to create your tattoo is contaminated with infected blood, you can contract various bloodborne diseases including methicillin-resistant Staphylococcus aureus, hepatitis B, and hepatitis C. MRI complications. Rarely, tattoos or permanent makeup might cause swelling or burning in the affected areas during magnetic resonance imaging exams. In some cases, tattoo pigments can interfere with the quality of the image. Ethics. There are religious objections to the practice and considered a dirty act as the ink enters the blood.
Here we come to the end of our video and this is the summary. Regarding health and wellness, tattoos nearly have no benefits compared to the multiple health risks and medical complications they cause. They may increase your antibodies, but it doesn't mean they'll boost your immune system.
Stop and think before you ink.